Across the web and throughout the country, the new guidelines are inciting anger and confusion.
If the doctors are not going to go along with it, I don't think we can certainly convince our patients to go along with it either.
Dr. Michael Grant will continue suggesting routine mammography at 40, despite the experience of patients like Rosanna Sandlin.
I need to schedule my next appointment.
She started screening well before age 50. After an abnormal mammogram, she underwent a sonogram and a needle biopsy.
I was very nervous, anxious. You pray a lot, you talk to yourself.
It turned out there was no cancer. False positives like hers led the task force to suggest new guidelines. About 90% of abnormal mammogram findings are benign.
A mammogram that is going to turn out to be falsely positive involves anxiety. It involves additional imaging tests.
The task force found that starting mammography at age 40 rather than 50 leads to 60% more false positives.
Mammography is not as sensitive a tool in general in younger women because their breast tissue is more dense.
Each year, about 1.6 million women get breast biopsies costing thousands of dollars each. With the vast majority turning out to be false alarms, critics charge the task force was more interested in saving money than lives. Not true, says Dr. Diana Petiti.
No. These recommendations have nothing to do with any kind of analysis that addressed cost effectiveness. Cost effectiveness was not a part of the discussion. Cost was not uttered in the room.
We called Medicare and the health insurance industry today. Both told us there are no plans to change coverage for mammography. Katie?
All right, Jon LaPook, thank you. And now we're also joined by another member of our CBS News medical team, Dr. Jennifer Ashton. Jennifer, you're an OBGYN. What are you hearing from your patients today, and what are you telling them?
Katie, my patients are so angry about this. They feel almost personally attacked. They are afraid. They do think it's about cost and money. And what I'm trying to tell them is that I share their frustrations and many of their feelings as a woman and as a women's health advocate. And at this point, I am not telling them to deviate from their practices and their screening practices at this point. But of course, with any patient, we are taking an individual approach to every case, but that's not helping. They're very, very angry.
And Jon, you know, the figures vary, but thousands of women between the ages of 40 and 50 are diagnosed with breast cancer every year in this country. So what about them?
Well, it's tricky, Katie, because experts tell us that there are three possibilities. One is a cancer can be so slow growing that it doesn't matter that you pick it up early because it wasn't going to kill the person anyway. Two, it can be very aggressive, and actually picking it up early doesn't matter because it's just going to kill the person anyway. And finally, three, and this certainly happens, a mammogram done between 40 and 50 can save a person's life.
So we should clarify, the task force is saying they're not telling women don't get a mammogram until you're 50. They're just saying it's not a blanket statement that they have to get one at 40, right?
It's not a mandate to do it. They're saying you should discuss with your doctor the pros and cons. You can still get mammography starting at age 40, but they're no longer saying we're going to do this for everybody.
And Jennifer, do you think that OBGYNs will ignore these recommendations as you suggested and pretty much keep doing what they've been doing?
I think the chance is that most of them will do that, but on the patient end, Katie, we're already seeing women pull back from their screening. We spoke to George Washington University Breast Imaging Center today, and they reported that they had more women cancel their regular mammogram appointments today than ever before. So I think we have not heard the end of this at all.
All right. Well, doctors Jennifer Ashton and Jon LaPook, thank you so much to both of you.